Hi, I'm Jimmy Innes, the Chief Executive of AD International, and I've been using the lockdown period to talk to some of our disability activist partners from around the world to find out the specific challenges facing people with disabilities through this time and what can be done to address them. Today, I'm talking to one of our partners from Uganda, out west, down in the southwest corner of the country in a place called Mbarara, an organisation called Tukore, a disabled people's organisation there. And I'm talking to Vicent Ngabirano, the representative of Tukore, to hear from him the situation. Now in Uganda, the coronavirus pandemic has yet to have as much impact as on some of its neighbours like Kenya and Tanzania. Cases are still relatively few, and there are no official recorded deaths as of yet. But the government acted fast and hard with some quite strong lockdown measures right from the outset. Schools closed, public transport stopped, and these are already having impact on the lives of people with disabilities.
Yeah, TUCORE is an organization for persons with disabilities, which was formed around 1979 with an intention of helping persons with disabilities to access education.
And what is the situation like for the Tukore members there in light of COVID-19 and the ongoing lockdown and social distancing measures in Uganda?
The situation is not all that good, because with lockdown, most persons with disabilities, especially in the Bara district, were locked down, and some of them they have less earnings, and at the moment some of them don't have food, and others they don't access medical services, especially those who are on daily drugs, like the patients of cancer patients, like HIV and AIDS patients, diabetes and epilepsy. So they are in their houses, they are not allowed to move, and therefore the situation is not good. And we appeal to the government at least to allow them to move freely without seeking for permission, because it is even very difficult for them to get permission.
What are you doing about it?
Yeah, we try to address this situation through radio talk shows, and went to Glory FM, went to Revival FM, and then Grace Radio. So while on the radios, some people called in and they told us that why can't we address this situation, the RDC, so that it can allow free movement of persons with disabilities to access those services.
And who is the RDC? Can you clarify that for me?
RDC is a resident district commissioner, is a representative, is a presidential representative of the district.
Very good. And is the RDC listening to your advice?
Yeah, I went there yesterday with a document. I listed all the things that would like him to put into consideration. Unfortunately, I found him in the meeting, so I did not get a chance to talk to him. So I left my document with the secretary, and she gave me the telephone number. So I will engage him on the phone, see if he can put those requests into consideration.
And what exactly were you asking him?
Well, I requested RDC to allow persons with disabilities to access those services, especially medical services, and we requested him that every time maybe he's giving out some relief items like food, he should put into consideration persons with disabilities, because last week they were giving out some food items, but persons with disabilities do not benefit much from that very kind of arrangement. Reason being that the mode of communication was not favoring persons with disabilities, especially the deaf community, and most of them did not get those food reliefs. Yet they are the very people who are vulnerable, and they want those things to be distributed to them.
Very good. And I understand in Uganda, the district has its own crisis management response team, which is coordinated at the national level as well. And these are in place for many years to respond to previous crises in the past, which are reflected in the country. So, but are there people with disabilities represented on that crisis management team?
Actually, it was one of the points that we also tried to address because persons with disabilities were not represented. So it would have been rather good if at all there was someone to represent persons with disabilities who would advocate for the equal distribution of those items.
Very good. Vicent, it's so encouraging to hear the work that Tukoli is doing there in Barada to represent the interests of your members and of all people with disabilities there in the town. And I encourage you to keep that spirit going.